They all come from different horizons. One common thing that matters to them is eye care. Here at the Presbyterian Pediatric Eye Hospital at Limbe, they have found the leeway to help the eyes. Sometimes they have come for checkups. Sometimes they have been diagnosed of eye diseases. Surgeries have been carried out, so too have glasses and eye drops been prescribed. It is a generalized eye care service universe altogether.
We perform other specialized things like surgeries here and other specialized tests like biometries and then ultrasound for the eye. We do central visual field test. We also do corneal pachymetry.
Contrary to popular belief, the ophthalmologist says eye care is a process and glass prescription could just be part of it.
Some diseases like uveitis, glaucoma cannot be treated by glasses. Cataract cannot be treated by glasses. So those, just to name a few, you have problems with the lids like trauma also that cannot be treated by glasses. So it's not, eye care is not glasses, and we should please note that. And that is the message we want to give the general public, that it is not all about glasses. And here is the opticians can be concerned only by glasses. So if you really want to have a proper eye check to diagnose all eye care problems, then you need to come to Acha Hospital here in Limbe, and we provide all those services. If you have diabetes, it's affecting your eyes, of course we have to treat. It's not glasses. If you have hypertension that is making you blind, we have to treat. It's not glasses. And therefore, glasses is only a minute part of the treatment for eye care problems that we can encounter.
At the Presbyterian Pediatric Eye Hospital at Limbe, every patient has an eyesight-related story to tell, and no one can better drive us through than Mutabe Fruitful, nurse at the hospital.
This is one of our sons. Prince Will, good morning. How do you feel? So it's a successful case of yesterday for cataract operation.
Therese Okule has suffered from the cataract disease for close to 8 years.
Since 2000 and then 2017, come here when the hospital sit down at Dam Beach. First I get premature cataract. So when it could be mature, I'll go in for operation. So last year it was a mature cataract. Well, last year was a mature cataract. So when I came here, the doctor said that I had some inflammation inside. My eyes still have some problems. So when I went in for some tests and so on, yes, they refers me that I will be operated on Thursday.
Though the doctors had told Okule the surgery would be dangerous, he was obviously ready to bear the risk.
I may lose my sight because the case is very, very complicated. He said that, am I agree with that? I said yes. He said, so she asked me that if I lost my sight, I hope I will not, yes, I will not feel bad, let me go in for the operation. But I myself, I'm very sure that I will gain my sight.
Cataract, some people say give me glasses. It's not about glasses, it's about surgery. And so we do all that here in our child.
Brian is another patient. He lost his sight the day acid poured into his eyes. He was brought to Acha Hospital Limbe by his friend.
It started when we went to the garage early in the morning. So we went to fix a brake system of one car in the garage. So when he got there, he was under to check where the leakage was coming from. So he sent his apprentice to go inside. He was the one to instruct him. He was to instruct him to match the brake after seeing so that to enable him to find where the leakage was coming from. So unfortunately, his apprentice went ahead and matched the brake when he hasn't instructed him. That was when the fluid came out, pressure spread in his eyes.
Brian's surgery was a success. Our camera light cannot allow him to lift up his eyes. His healing process is underway, the nurse explains.
He brought as a blind man, and they were just like passing, you see. They were just like, okay, let's just confirm it and it should go back. But by the grace of God, after our intervention, this is one of the patients that are giving us sleepless nights throughout the past 2 weeks. Because at times we come, he can testify. We'll go, they'll call us, we'll come back and leave their eye at midnight just to save the eye. And it was really, really successful because he can move around and
Welcome to the planet, Echo. Welcome to the planet, please. I'm glad of my head. Get fit. Well, you should have picture of my phone and I didn't
Not too far from Brian is Collins. He is a glaucoma patient and has been under the Presbyterian Pediatric Eye Hospital for 8 months now.
Because the nature of glaucoma, you have to only treat for that moment, but we cannot really cure glaucoma. Yeah. He was somehow discouraged, but we gave him hope that it's better for him to maintain the sight where at the level which it is. And he's very, very serious. At his age, he's not like giving up like some other people out there. When they know that they have been diagnosed with maybe glaucoma, they will not even want to cast it after all. It's not my eye will see blind, it's a lie. When you follow your treatment, you follow your rendezvous, you maintain the sight where it is and you see more better in future.
It has not been an easy ride for Collins.
I'm in clear vision, not see very well. Still having difficulties to study. Then I struggled to write my exams after my last level. I went to the university. December, after the Christmas break, I came here to come and spend some time with my people. So on my way back to Boya, I could not see, the vision was blurred, so I was advised not to come here. So I started coming here. So by now, I started coming here, I feel better now, and I can even see, I can even manipulate my phone, I can even read. So I feel much better now.
Glaucoma can also be treated by surgeries. But of course, surgery is not the first line. The first line treatment for glaucoma patients, which we see a lot in this place, and that gives you an irreversible type of blindness. When I say irreversible, it's really something that I want to drive into the ears of all Cameroonians, is that it cannot be brought back if it has gone. However, if you detect it early, then something can be done about it. You can be given your eye drops, and you will maintain vision if you are consistent, you are using your eye drops properly, then you can prevent blindness from glaucoma. But the bottom line is early diagnosis. And glaucoma, do you even know that you have a problem when you have glaucoma? You don't know. Because glaucoma is called the silent thief of sight. Silent, so silently it's eating up your vision gradually, very small, and by the time you as a person realizes that you have glaucoma, it is too late. The vision is totally gone, and nothing can be done about it.
The operating theater of the hospital has seen several eyesight improve in a split of a second. Today, the surgical team of the hospital is attending to many patients. One of them has cataract. His operation will begin in a few moments. The equipment are set and the machines are ready. The patient's details are being reviewed.
Vision right eye 6 to vision left eye 360. Eyes negative. Lens power 22.5.
The time is critical and every decision is vital.
So this is how the cataract lens that used to be clear, transparent, has become opaque. This one has overstayed and become brownish because of long term. They did not bring the patient on time and it became so dense. And this is what blocks the light from entering the retina. And once you remove it, you give the patient room with an implant to see after operation.
Further away is the refraction room. Here, tests are carried out on patients to figure out which prescription they need for their glasses.
Okay, this is the refraction room. What I mean by the refraction room in simple terms, it means where you check patients for glasses to get the strength of glasses that they need.
Over to the glass room, style, fashion and taste inspire the patient's choice of the lenses frame.
Their glass now, it go there so like this one, maybe 2 times thicker than this. But if you feel this one, feel another one. You see that for this middle, it be slim, but this edge is a bit thick. So they advise people that they get this kind of glass. I mean, you take a small frame. So say when you take a small frame like this one, when you want mount them, they'll put an inside so they'll shape only that thin part where you feel and so you see say they'll throw away this fat part the way where you wear your glass. First you know just look so no say you are hypo and really be severe. So in as you want to choose your frame, you consider this into consideration. This is a glass shop where we have display of frames. So when you're being prescribed glasses, you come in here, so you choose any frame of your choice, and then your glasses is being fitted into the frame so that you can look beautiful and also treating your eyes as well.
Looking beautiful while treating the eyes matters a whole lot.
Normally, it's the patient's choice. The patient chooses any frame. However, we have certain prescriptions that we go for certain frames. So when the patient comes in with the prescription, from looking at the prescription, we guide the patient in choosing the right frame that we go for that prescription.
And children are also part of the show.
Very nice. I'll take this one now.
There are certain measurements that we use for certain glasses. For example, if you're using a progressive glass or a bifocal glass, we have some measurements that we have to take so that when your glass is being mounted, it should be well aligned in the frame so that you will not have any difficulty using the lens. For example, we take the PD of the patient, we take the segment height of the patient while wearing the frame.
The Presbyterian Pediatric Eye Hospital in Limbe has given hope to many at the verge of blindness. Many say they have serenely resumed their activities after treatment.
Hallelujah, praise God. Because see, the way we are having yesterday, see the other day I come for Tuesday where they preparing against that yesterday. And yesterday they do, I've been at the first patient for come inside the theater.
Yes.
Successfully. In fact, I don't know, I praise God where He passed through the nurses and the doctor for do this work for me, for be able now to see clearly. The eyes where the operator yesterday, it is shine. It is like when I say, Mona wash me, do one me. Although it didn't get a problem, Mona don't want to make balance with the other side. So I want to talk for the whole was saying, Archer Annex for Limbe, where they operate for the school for PGSS for my 4 years at the best.
Today, after the removal of the bandage, I can even see far distance more than a kilometer. I can read my side back and no problems. So I'm very satisfied, I'm very happy.
At one time here, I get big difference from the Wednesday I was here and today. Since they do the operation, I did fine.
Archer Hospital Limbe provides healthcare services to all and gives children a special place in her heart.